Okay. Hello, everyone. My name is Nidra Copelin. I'm a fourth-year pharmacy student at Xavier University of Louisiana.
I'm Vincent Ekenga. I'm a clinical assistant professor at Xavier University.
And the title of our study is The Impact of Collaborative Chronic Care Management with Remote Monitoring on Blood Glucose and Blood Pressure among Federally Qualified Health Center patients. So for our introduction, adequate blood pressure and blood glucose control results in a significant decrease of the development and progression of microvascular and macrovascular complications. The American Diabetes Association recommends an A1C of less than 7%. The National Committee for Quality Assurance designates adequate blood pressure control at less than 140/90, a common performance goal for many clinics. Chronic care management is a payable service of primary care that contributes to coordinated, high-quality care. Remote monitoring and chronic care management involving pharmacists have had significantly positive effects on A1C and blood pressure. Incorporating care management teams is a strategy that has shown to improve A1C and blood pressure recognized by the CDC and American Diabetes Association. For our objective, chronic care management is typically available to older adults via Medicare, and this study placed no limitation on age or insurance status. It was conducted among fairly qualified health center patients. So our aim for this study was to assess the impact of chronic care management, which included a primary care provider and a pharmacist care team with remote monitoring on blood pressure and blood glucose. For our methods, the eligibility was age 18 years of age or older, uncontrolled hypertension, greater than 140/90, uncontrolled diabetes, which included an A1C of greater than 7%, an agreement to use technology between the patients. And for our setting, it was between 4 Louisiana federally qualified health centers, 1 in person and 3 via telehealth. For recruitment, the primary care provider referred to the pharmacist for chronic care management between October 2020 and November 2021. And for intervention, the periodic follow-up between the pharmacist provided chronic care management activities, which included care coordination, counseling, primary care provider collaboration, disease management, and this took approximately 20 minutes per month, and this was IRB approved by Xavier.
Our sample was 30 patients, 24 for diabetes and 6 for hypertension, with an average age of 54 years of age. 53% were women, 90% were Black and Latino, 30 were non-English speaking, and 93% had some form of public insurance, so Medicaid or Medicare. There were 24 enrolled in the diabetes program, with 17 having at least 1 follow-up, 6 in hypertension, and all 6 had at least 1 follow-up. Of the 17, 8 had a reduction in A1C, 92% were adherent to technology testing as recommended, and there was a 21% decrease in the A1C in these patients. 50% of the patients with hypertension were adherent to technology usage. 2 achieved blood pressure control. The average diastolic decrease was 9 millimeters per mercury, and the average systolic decrease was 15 millimeters per mercury. Effects on blood glucose and blood pressure were not statistically significant, but they may be clinically significant. Effects of technology may be affected by remote monitoring implementation. So whether there is cellular technology or Bluetooth technology available, web-based platform versus a manual app-based platform. Chronic care management also decreased blood pressure and blood glucose for those less than 65 years of age. So these people would not be Medicare eligible. So those outside Medicare may also benefit from chronic care management as well. In conclusion, a pharmacist primary care provider chronic care management service with remote monitoring is a promising intervention to improve blood pressure and blood glucose among engaging participants at fairly qualified health centers. Further studies are needed for best practices and long-term effects. This project was supported by the Health Resources and Services Administration. The views expressed in this presentation are solely the opinion of the authors. We would like to thank you all for listening to our presentation today and acknowledge the following people.